If you've already studied how to take a history in English, but you still hesitate or sound unnatural when you speak to patients, this video is for practice. We already have a full teaching video on history taking in our consultation series. This video is different. In today's lesson, you'll hear a complete abdominal pain history, review the key language doctors use, and practice asking the questions yourself out loud. This is consultation English in use, not theory. Let's start with the role play.
Good morning. I'm Dr. Ahmed. I understand you've come in today because of abdominal pain. Is that right?
Yes, that's right. I've had stomach pain since yesterday evening.
Okay. Could you tell me exactly where the pain is?
It's mostly on the right side, lower down.
I see. And when did it start exactly?
Around 8 o'clock last night.
Has the pain been constant or does it come and go?
It started as mild pain, but it's been getting worse, and now it's constant.
On a scale from 0 to 10, where 0 is no pain and 10 is the worst pain imaginable, how would you rate it now?
About 7.
Have you noticed anything that makes the pain better or worse?
Moving makes it worse. Lying still helps a little.
Have you had any other symptoms, such as nausea, vomiting, fever, or changes in your bowel habits?
I felt nauseous and vomited once this morning. No diarrhea.
Any problems passing urine, pain, burning, or going more often than usual?
No, none.
Have you ever had similar pain in the past?
No, never.
Do you have any medical conditions or have you had any surgeries before?
No, I'm generally healthy. I haven't had surgery.
Are you taking any regular medications or do you have any allergies?
No medications and no known allergies.
Thank you. That's very helpful. I'm going to examine you now and then we'll discuss what the next steps are.
Now that you've heard the full consultation, let's slow it down and focus on the language. In the next section, I'll highlight 10 natural medical English phrases doctors commonly use when taking a history from a patient with abdominal pain. These phrases should already sound familiar if you've watched the history-taking lesson in the consultation series. The goal here is accuracy and clarity, not memorization. Part 2. Language Breakdown. 10 natural medical English phrases. 1. I understand you've come in today because. This phrase sounds polite, shows empathy, sets a professional tone. It's much better than, why are you here? 2. Could you tell me exactly where the pain is? Could you softens the question. Exactly encourages precise answers. 3. When did it start exactly? This establishes onset, which is essential in abdominal pain assessment. 4. Has the pain been constant or does it come and go? This is a classic contrast question doctors use to differentiate causes. 5. On a scale from 0 to 10, how would you rate the pain now? This is standard pain assessment language in English-speaking healthcare systems. 6. Have you noticed anything that makes it better or worse? This avoids complex medical terms like aggravating or relieving factors. 7. Have you had any other symptoms such as nausea, vomiting, or fever? Such as helps guide the patient without closing the question. 8. Any problems passing urine? Short, natural, professional. Doctors often speak this way. 9. Have you ever had similar pain in the past? This helps identify recurrent conditions. 10. That's very helpful. A simple phrase that builds rapport, encourages cooperation, and sounds confident. Part 3. Pause and speak practice. This next part is the most important part of the video. Listening helps, but fluency comes from speaking. In the following exercise, you are the doctor. I'll play the patient. You'll pause the video and respond out loud. Speak clearly at a natural pace as you would in a real consultation. 1. Patient. Doctor, I've had stomach pain since last night. Ask about location of pain. Model answer. Could you tell me exactly where the pain is? 2. Patient. It's in the lower right side of my abdomen. Ask about onset and progression. Model answer. When did it start and has it been getting better or worse? 3. Patient. It started yesterday evening and it's getting worse. Ask about severity. Model answer. On a scale from 0 to 10, how would you rate the pain now? 4. Patient. It's about 7. Ask about associated symptoms. Model answer. Have you had any other symptoms such as nausea, vomiting, or fever? 5. Patient. I vomited once this morning. Ask about urinary symptoms or past history. Model answer. Any problems passing urine or have you had similar pain in the past? Excellent work. Repeat this practice until your questions feel natural, you don't translate in your head, and your English sounds calm and professional. If your goal is to communicate clearly and professionally with patients in English, watch the full consultation series, practice speaking out loud, and repeat these exercises regularly. Subscribe for more Medical English Pro. See you in the next consultation.